Hello. Thanks for being here for this discussion today. I'd like to invite the mayors to come up here. If they're in the room, we have Mayor Sandra Schroyer from the city of Kotzebue, Mayor Kenny Bell, the mayor of the city of Iqaluit, Nunavut, Mayor Dave Bronson, the mayor of the municipality of Anchorage, and Mayor Harry K. Brower Jr., the North Slope Borough Mayor. Hope you're all here and you can come on up.
No matter where you sit?
I don't think so. Any chair, except for this
Any
one.
chair, that's the hot chair? Hi.
At the daylight, and they're coming from the dark. Sitting in the order.
Anywhere you'd like.
Oh my God.
Hello. Okay, is this on? Yes.
Mayor Bell, am I saying it correctly?
I was trying to practice. All right. Yes, water would be good.
Speech ready and you're sitting in front of the
All right, well, let's get started. Thank you so much for being here for this discussion on what has been, without question, one of the biggest challenges for all of us, and especially for elected officials. You have to go back a full century to the pandemic that was known as the Spanish flu to find a comparison to what we faced over the last 2+ years. And for people in rural Alaska, and likely for our rural Canadian neighbors, the stories of the devastation of that illness, how it wiped out nearly everyone in some communities, created another layer of anxiety. And although we know that millions have died across the world from COVID, we also know that many communities rose quickly to the public safety challenge and did everything they could to help keep their local citizens safe and alive. We also know that the challenge wasn't just COVID. It was fear, it was anger, and misinformation that sometimes caused delays in implementing protective measures or rejection of them. So, how did the mayors who are with us today grapple with these challenges and decide how to respond? I'd like to start by hearing from our Canadian visitor from Iqaluit, Nunavut, Mayor Kenny Bell. Mayor Bell, thank you for being patient with my problems with pronunciation. Tell us what happened in your area more than 2 years ago when we really started to understand the severity of COVID-19 and leaders had to decide what to do because this wasn't going to be, when it became apparent this wasn't a short-term event.
Yeah, thank you everybody, and just let me start by saying it's always a pleasure to represent my city, especially at an event such as this. I don't speak on behalf of Inuit, but I do speak as a lifelong friend and neighbor, and I've lived in the North I was born and raised in the North my entire life. You know, Nunavut is a very unique situation. We have 0 roads in. Every one of our 25 communities are fly-in, and the government in Nunavut, you know, greatly supported us through the government of Canada as well with funding. But they made hotels in the south where we had to stay. Actually, if you traveled out of Nunavut, you couldn't get back in unless you stayed in these hotels for 14 days before you came in. And that was basically just to make sure that we had enough time to get people vaccinated. Because our healthcare system is so weak right now. We only have 1 hospital in the whole territory. Every other community has a health center. So we wanted to make sure that we gave our health providers the opportunity to you know, become stronger with vaccines. So you know, our city has a 98% vaccination rate, which is you know, unbelievably amazing. Our territory is a lot less, probably around 70, but you know, it's just everyone worked together, and that was the most important thing. But also, you know, the government of Canada realized that they needed to support our Inuit organizations, which are very important to our area, of course. and they were providing funding to provide food boxes to Inuit, to provide food boxes to people of need. You know, about another thing, they paid to go out on the land. They allowed us to go out on the land more to get us out of the staying at home and just being kind of stuck. So, you know, it was hard, but it was very good partnerships, and that's one of the main things we've learned through this pandemic, is that we need to work together, especially a small population like ours, which is only like 39,000 people. So it's hard to get through these things, but together we're a lot stronger.
I was going to ask how your community responded when you first started to put these measures in place, but it sounds like people really adopted them quickly. 98% vaccination rate, that's outstanding and really amazing that you were able to do that.
Yeah, absolutely. We couldn't be prouder of our citizens, and you know, we're very social people. We want to be social, and we want to be hanging out and having fun with each other. And that was the hardest part, actually. You know, we had zero. We weren't allowed having anybody over for a full year, and actually, we didn't have COVID in our territory for a year. We made 1 year in. We were I believe we were the last place in the world to have COVID enter. So, you know, we did a lot of it. You know, it just cost a lot of money to make sure that happened. I think the hotel hubs cost 130 million over the last 2 years. But you know, I mean, we saved a lot of people, and overall, I think we've had you know, 6 deaths, which is terrible, but very good compared to the rest of the world.
All right, thank you so much for getting us started there. Some communities in Arctic Alaska were hit very hard by the pandemic. Kotzebue Mayor Sandra Schroyer, give us an overview of when you realized you would have to develop a public safety response, and then what you did implement.
Let's see if this works. Can you hear me? Okay. When COVID first came out in Kotzebue, we had a massive shutdown from our schools to our communities. And then we came up with the game plan, and I have to make a long story short, one of my family members was one of the first ones that tested positive, so we had to go into quarantine right away. They came to my house and they showed up in their white suits and they had their glasses on and their gloves, and I said, "Get in my house right now, the whole town thinks we're really infected here and whatever," and they said, "We're sorry, but we don't know what this will do." So anyway, the community and the region actually came together, and Manilk, our health organization, I'm very proud of them because they got together and they formed a task force with the Northwest Arctic Bureau, and they started talking about protocols and what we were going to do, and they came up with this task force that met weekly. And then we started getting folks where they were tested. Alaska Airlines and our Manilk folks would go to the hospital and tell everyone, "You need to go over here to the Bering Air hangar and you need to be tested before you can travel." And I have to tell you that Bering Air was, we call them the Bering Air cops, because they help support our folks that were tested. They would not let you on the airplane to go to any of our villages in our region unless you had a negative test. So if you showed up and you said, "I need to go to Buckland today," they say, "Show us your test." And if you didn't have it, you could not travel. And you know, they got barked at, beat at. I mean, they got a lot of flack. But we call them the COVID cops, and they did really great for Northwest Alaska. So anyway, with Manilk, they got a team together, and once they got the vaccine, they traveled to every village, every single village, and hit as many as they can as far as trying to get people vaccinated. And it took 3 or 4 trips to get people caught up. There were some who were resistant because it's the unknown, and people don't know what to expect with the vaccine. So some people to this day are still resistant. But I do appreciate the work that Manilk did, and also the city of Kotzebue and the borough and everyone that came together and talking about that.
All right, thank you so much, Mayor Schroyer. Anchorage Mayor Dave Bronson has obviously a much larger group of citizens, close to half the state's population, to protect and try to find consensus on how to handle the pandemic. Mayor Bronson, we know from the headlines that this hasn't been easy. And could you talk about what you thought was the best approach for the state's largest community and what you put in place and the difficulty around trying to figure out what would work?
Well, remember the timing of it. We came into office in July 1st of last year. Much of the sanctions and the measures were already being withdrawn by that time. So a lot of the very challenging decisions were made more than a year before that. So when we came in, by that time we had the advantage of a lot of data behind us worldwide. The meta-analysis was starting to be done, and so I took an approach based on personal values and what we thought was the best path as we compared the various jurisdictions. So we would compare Israel, which is at a 98% vaccine rate, and we'd compare that to Sweden and find out who did what and what the outcomes were. Because early on we knew that there would be very significant economic outcomes to shutting down society and businesses and the economy. So we had to strike a balance, and my balance is a matter of individual liberty. If you chose to wear a mask, we supported that. If you chose not to, we supported that well, and I was never going to do vaccine mandates of any form. So, but then again, the challenges were before I came into office, and so we never got to that level of mandates, and I think taking a more hands-off approach, there's constitutional issues involved, there's liberty and issues involved when you start telling people what they have to do and what they can't do and what they must do. So our approach is more hands-off, and we allowed people to make decisions for themselves.
As you are, of course, well aware of, there was a lot of division and a lot of vitriol over masks and business closures. Do you think in hindsight there was a need for more communication or outreach about public health and safety protocols? Or do you think that there was just so much anxiety and fear over something that none of us had dealt with before that it was just bound to be a fraught time?
Yes, and yes. It was when society is living in a period of, I guess, of ignorance. Everyone gets scared. Both in this issue, both sides were. People were worried about what's the economy doing. Am I going to lose my job next week? The other person is, well, I want to go into a public space, but no one's wearing masks, and I want to be in a public space, but I'm afraid I'll contract the virus if I do. So we understood both sides, but at the end of the day, I believe the individual can make the decision what's best for them. And when you get into the compulsory stuff, again, from the government, telling people what to do in a very personal sense, that's an area I don't like to go. And so that's the path we chose.
All right, thank you, Mayor Bronson. And North Slope Borough Mayor Harry K. Brower Jr., please describe for us what you did at the borough level, and did you coordinate safety plans with community leaders in the communities of the North Slope? I imagine you did.
And thank you, Laurie, for the question. It's an effort that was put into play with the community. We identified with the incident committee in the situation of this sort of a pandemic that we don't know about, what we're learning from news coming in, building strategy to identify with the communications of the new language coming in. Hunker down. Where's everybody going when we're doing this hunker down? And then the criteria that we had to identify with in terms of, do we keep our offices open? How do we keep our community functioning? I mean, the day of the COVID crisis, the hunker down activities, one of our air carriers shut down and filed for bankruptcy and caused a little havoc in terms of transporting goods into our villages. The communications was at the best, at most. Delivering the message, we had to build up a system that would function for not just one community, all the communities. And the messaging that was coming out, proper hygiene and such, and if you do become infected with the COVID virus, there's got to be isolation, and that becomes a real problem for smaller communities. In the larger hub community, we had to plan And thanks to the community leadership that we were able to provide for the larger hub. You know, the smaller communities, we had to structure a plan that would function for them, because they don't have all the luxury in the larger communities, the larger hub communities. The smaller communities suffer twice as much in terms of what are they supposed to be, water services, not as luxurious as what we see here in Anchorage. That's a problem. Proper hygiene and that kind of messaging. And I had to look into our faith-based organizations that help communicate what this virus is identified and spreading so rapidly across. And the message at some of the communications was close the gate to the North Slope, stop the air carriers. But then there's a rippling effect from when you do put a stop into the air carriers, the freight stops coming, the mail stops coming, the medicine stops coming. So these are things that we had to identify with in terms of how do we structure this hunger down. And then looking to our industry, oil industry partners, to identifying the practices that they were performing in the oil fields as well. So we had to take in the larger community in developing these incident command to address the concerns coming from the community. What is it that we're missing? What is it that we're lacking? What is it that we need to perform or elevate a bit more to the areas of concern that were being suggested in through this communication structures that we had for our public health services. Oh, I have to be very thankful, just like Sandy, to our public health service providers. They're the ones that were putting their lives at risk, not knowing the outcomes of the pandemic and the virus that was attacking a lot of our members. Who's going to be very susceptible for the ailment that comes with it, if you have an underlying ailment. These kind of questions we had to learn of, and communicating more directly to take the precautionary measures. In our Inupiaq way of life, we're very social, open, visiting. Our relatives come into our homes without even knocking on the door. They come barging in and acting like they're still part of the family. That was kind of put to a stop. How do we minimize the spread of the COVID? I mean, it tore a lot of family members into isolation, and I felt a lot of sorry for our elders that were being very careful. They listened to the news. They listened to Laurie and the communication that you were providing early on in the start of the pandemic. That kind of communications was very important in building up with the incident command. That we had to structure in that incident, even though there was the emergency orders were not coming from the governor. We were from the federal government. We acted on our own with our community in terms of how to minimize the spread of the COVID virus.
Well, Mayor Brower, I'd like to stay with you for just a moment, and we'll kind of reverse the order here. As you were noting, and you were talking about communications, it was difficult, especially in the beginning days of the pandemic, to communicate quickly and frequently about changing safety guidelines and what actions your administrations had to take. So how did you stand that up? Mayor Brower, continuing with the statements you were making earlier about communicating with the smaller communities especially, I know that there are a lot of places that don't have high-speed internet, so it's not as easy as just sending out an email blast or some sort of a Zoom call or something. Do you have an emergency communication plan for the borough that helped you reach people when they couldn't come together at community centers to get information? Because, of course, that wasn't the way to get the word out any longer. In days past, maybe that would have been the way. You'd bring people together and talk about an incident that the community had to deal with. But, of course, you couldn't do that in this setting.
And thank you for the questioning, Laurie. It's, planning and utilizing the resources that were available to us right in our own communities. We've had our emergency services across the North Slope border that we provide the communications between the fire department, the police department, the healthcare emergency responders. They have the communications infrastructure that's needed from in the village and outside and to villages. That was one of the key items that we had. We also had our telephonic equipment that we identify with in terms of our communications to villages and village leaders on specific issues that were being identified through their communications. These are the communications methods that we had to identify within the incident command. It doesn't just go one way. It's got to be able to go both directions, in and out. If there's an emergency in the community, a high rise of COVID cases increasing in one village, what is it that we're going to do? We had to use the healthcare providers to be prepared for that. And we did have several instances for that purpose. The healthcare providers having to be transported from the hub community into the village to go address the issue of the COVID in the villages. So, yeah, I was going to say thank you. Thank you, Sandy. That's the problem with Mike. We can't either swallow it or talk to it. You know, I learned that joke from my uncle a long time ago. Let me just share this little joke with you. We were at our whaling camp, right? And he's talking stories to him, and I kept leaning closer to him and bringing the VHF mic closer to him. And then he goes, "What do you think you're doing?" And he goes, I was going to share your stories over the VHF on how you were doing things. And one of my cousins came up to me and said, "Tell him to swallow the mic so he could listen to the rest of the story." Anyway, no, I lost my train of thought.
Well, we're talking about communications plans.
Okay, the communications.
Yes.
Thank you. That we were fortunate. We had the communication systems, the telephonic communications between the healthcare providers and the health aides in the villages. That stream of communications was there. We also needed to communicate on coming back to the healthcare providers was the most important part. That a situation arose in a couple of villages that we had to transport the healthcare providers from the hub community to the village to go monitor and isolate people that needed to be isolated and giving the medication that was needed for them, the vaccinations that were identified with to help lessen the spread of the, and again, repeatedly educating the people, restating what was being said or asked of, to making sure that you're social distancing, wearing masks. If you have an individual in your home that's sick, isolate them into one room and identify one person to communicate with the individual as to what needs to occur.
Yeah.
The problem in these smaller villages is that our homes are so small, there's only one bathroom. We don't have the luxury homes that have 2 or 3 bathrooms in a home. And that was a problem of trying to identify with in the communications of minimizing the spread of the COVID
Absolutely.
virus.
Well, thank you, Mayor Brower. Mayor Schroyer, talk a little bit about that task for you and accomplishing community communication in Kotzebue at a time when people were needing good, clear, and frequent information, and it was made very much more difficult by the fact that you couldn't get up close to people to give that information.
Well, you know, again, we got to the task force, which they also formed, and it became a core group of our region, and people would communicate from the villages to the borough with the city, and we all came up with protocols. But luckily with our villages and our IRAs in the cities, in our 10 communities, they formed their own rules and their own guidelines. You can't come into my village unless you have a negative test. You cannot come in here unless you have a negative test and you're an essential worker. I mean, they were very strict. The problems we had were if you had to quarantine, because we didn't have a lot of places to quarantine. We also had people who had to quarantine. Let's say they were going to a village and they tested positive in Kotzebue and they had to quarantine in Kotzebue. So they would have to stay at a hotel. But later on, as it became lengthier, the time, our health organization put in housing, the temporary housing like you use for construction camps. They put those in there for folks to stay because folks were staying in a hotel and they're trying to keep them separate, and it was really hard, but and probably one of the toughest ones was the mask mandate. People don't want to wear a mask. People don't want to be told what to do. But we did put that in there, the mask mandate. As a matter of fact, I'm very proud of the city of Kotzebue. We finally lifted ours last week, that you no longer have to wear a mask. It's an option if you want to, and any other business or whatever, can, if they require, there are some stores in Kotzebue that still require that you wear a mask, and that's up to them. So we just lifted that, and I'm really thankful that we did, because we had COVID running wild. I mean, you know, it was like, oh, I am not going to get it. I'm not going to get the shots and the booster shot and whatever. But the more and more the numbers got higher, people started getting scared. And then, of course, every single one of us probably in this room know a few people that have died from COVID. So people started realizing it was real.
Well, thank you, Mayor Schroyer. And Mayor Bell, how about in your area? I don't know what kind of internet connections you have in the region, but how were you able to get emergency information out quickly?
Yeah, thank you for the question. So Nunavut is solely relied upon on satellite internet, and it is obviously very terrible, especially in this day and age. But you know, through the government of Nunavut's leadership and the support of the government of Canada, we actually forged better relationships because we were on the phone all the time. We were talking to each other very regularly, and you know, throughout the communities, you know, mayors to mayors and government to mayors, and we really were just doing things for the best of our communities, and we weren't asking for MOUs or you know, contracts between each other or anything. It was just, hey, let's just make sure that our citizens are safe and worry about all of the rest after. Even money, we weren't really worried about money. We just did what we needed to do to make sure that our citizens were safe. So, you know, looking back at it over the last 2 years, we actually have better relationships today where our Inuit organizations, our government in Nunavut, and the cities and municipalities are all working together on other functions now, on housing, on water infrastructure, you know, things that have been lacking for decades and will be a very hard process forward. But now we have these relationships, strong core relationships that we can actually lean on and get things done without all of the old nonsense of, you know, sitting down and making sure our MOUs and contracts are you know, all our I's are dotted and T's are crossed. So it's you know, that's one positive that's come out of it.
That's really extraordinary that you, through an emergency, were able to strengthen relationships to the point where now you're able to work on other things going forward to help your communities. You're right, that's one bright spot that came out of that. Thank you. Mayor Bronson, again, your challenges were larger because Anchorage is on the road system, and there is a lot of international travel through Anchorage. What were the discussions within your administration about how to effectively and quickly reach the broadest cross-section of Anchorage residents with very important community safety information?
Well, you're right in the beginning. We can't isolate here. It's not possible. In fact, I think the first case in the state came as an international pilot, FedEx or Atlas or something, came into the city. We all heard about that on the news. We believe that was obviously the first person tested coming into the state. We took an approach as of last summer in pretty short order. I directed the adoption of the policy of early treatment saves lives, and it's just to mirror. I didn't want to have to go out and reinvent the wheel because I was new at this. I adopted a jurisdiction, Florida, and the governor there, and what he did, I figured he had a pretty good staff that, and is what he did is he really advanced the notion of monoclonal antibody treatments to save lives, because our notion was this was a respiratory disease, and of course if you know, the notion of going home and laying down when you have a respiratory problem, a lung problem, we you know, if someone told you, if you're diagnosed with pneumonia and someone said go home and lay down and don't take any drugs, they laugh at you. Well, this is essentially the same thing. It was a respiratory thing. We've learned now that rotating, if you're going to lay down, you rotate every 20 or 30 minutes, and you can clear the lungs much better, far better outcomes. And then, and I've had COVID 2 or 3 times. The second time I went and got the MAB treatment, we stood up a facility at at a hotel on 36th Avenue. And we got great response from that, and we got a lot of feedback. People says it saved our lives because they came in, they were sick, they took the treatment, and some of them even added on other treatments, pharmaceutical treatments, and they did very well. We feel very positive about that, but we had to follow a model since we were so new that we thought was successful, because we were looking at the outcomes of, like I said earlier, various jurisdictions, Florida versus California, two warm climates, large states. What are they doing? The outcomes in Florida were far better, so we didn't pick the California model, we picked the Florida model, and I think that turned out well for us. And I think it helped protect the economy, because there's a deficit or a problem, I should say, when you shut down an economy. Suicide rates were up, suicide ideation rates were way up, especially in the military here that joined the city. We had to deal, we have to look at that. It's not just COVID, it's, your response to COVID can also be problematic. And we were trying to find that way to minimize all of those impacts on the city. I think we did a good job. But to be fair, a lot of the big challenges were a year and a half, 2 years earlier before we came in. But then on the other side, I campaigned for a year on the policy that I wound up adopting, because I think that was a better reflection of the data that was out there in the research. And it's, I chose to listen to experts that maybe a lot of other people didn't. But that was a decision we made, and we hope it helped the economy as well as helped the population.
All right, thank you, Mayor Bronson. Let's open it up a little bit for all of you. Anybody can jump in here and answer this. When was it the hardest, either because of illness rates and death, or because of backlash in your communities over mandates, or people thinking that you should have mandates? Mayor Bronson, you were talking about, concerns, the ripple-on concerns of people feeling so much despair that they're considering ending their lives, or business closures, people losing their jobs. When was it really dark, and how did you navigate your way through that as leaders? You even at your darkest, you have to be able to put on a face to the public that everything is okay, whether you feel like it is or not. So when was those periods for you, and how did you get through them?
Well, for us, again, from the beginning, I think it got better as after we came in, but things were getting naturally better. The vaccines were working in the beginning, and then later on, their efficacy dropped way down, and so we knew mandates and that nature weren't gonna do any good. We just had, like I say, we had to strike a balance. And I think the balance versus economy versus jobs loss, we lost a lot of businesses. We lost a lot of jobs. And it wasn't necessarily all of it due to COVID. It was due to the response to COVID. And so we tried to mitigate that as best we can, even as we came in late in the game. But again, I think we took the right path. But it was challenging, because it's exactly what you said. We were getting a lot of feedback on both sides. No mandates. We want mandates. Those people should wear masks if they're in public, and then the other says we don't want to wear masks in public. So how do you strike that balance when you got two people, or you got a population on each side of you? I think it's roughly 50-50, hollering at you. You just got to strike a balance, because as mayors, as elected officials, we govern for 100% of the population, not the half that put you into office. So it was a balance. We did our best. I think our outcomes were as good as any.
It was really tough. I'm not going to lie. Our people had a hard time. We have long winters. It's dark. We all started taking vitamin D. We had behavioral health problems. We had social ill problems. We've had a lot of child abuse. We've had issues like this that have happened. Our health organization, the school district, the borough, everyone, besides people having a negative test, they started trying to figure out what they can do for their employees. And a lot of our employees started working from home. We don't have the luxury of having a Montessori school or a daycare or other places for people to take their children. So when school was canceled, a lot of parents had to stay home. The problem we had in our villages too, and some of Kotzebue, is some of our residents don't have Wi-Fi. So we want our kids to get on the computer, and we say, okay, we're going to have your class today on the computer. And my first grade grandson couldn't understand why he couldn't go to school, but his brother, who's in special ed, went to school every day because he can't see. So he can't get on a computer. So he had to go to school, and he had hands-on. But the problem is we didn't have Wi-Fi for some of our kids. And this really put our kids behind in education. It's really tough. So whoever the next new governor is, you better step up and get that Wi-Fi back to rural Alaska like you said you would. So anyway, a lot of our kids struggled. So we have kids who are lacking in their education, and now we're going to try to catch up again. So those are issues that are really hard to do what you can, but that's what we did, and we had to do the best that we could. But you know, lots of parents work from home, and I felt sorry for the single parent who had to work from home, and if they had children. It makes it really, really tough.
Absolutely, thank you. Mayor Brower.
Thank you, Laurie, and thank you, Sandy. You know, you hit on the points that we have similarities to in our region as well. The communications infrastructure was not all built up to what it is today, as to broadband and the internet services. Again, the services for the school children that were needed to be homeschooled were struggling with hooking up to the internet. They didn't have that access or privilege or having both parents working and able to pay for the service that's being requested for or identified to use to homeschool children. That was a bigger problem when we seen that. In the trying to educate the students was becoming a problem one way or the other. It didn't fit for a lot of people, but then there was the more fortunate ones that were able to identify with getting homeschooled and identifying with the internet services that was being provided. These are the similarities, that problems of broadband that we didn't have, and it's still a problem today because it's so expensive. And the type of communications that it is needed to provide that service from school to the student at home, and then the communications back to this teacher and trying to identify the processes. Did I do this right? Or the students asking the questions were becoming to be more difficult to respond to at ways. But anyway, the communications for us to continue building that, I think it's been a learning experience for us from the start. You know, when I was identifying with closing the gate earlier, that was basically what needed to occur. Shut down everything to making sure that minimizing the spread of the COVID virus, because we didn't know about what it was going to take and how devastating it was going to be until we started hearing and learning more of the communications through the news services that were being provided. And then what portion of that news do you really take in for real when you're in the smaller villages, which were more harder to communicate with because we have to go and interpret with them what we learned, and then trying to share that information with them when they are left with less of communications infrastructure that was needed to be in place. Thank you.
Thank you, Mayor Brower. And Mayor Bell, how about for you with the darkest points?
Well, I mean, we have a very clear darkest point. Our city, in October actually, we had a water emergency where we found oil in our water. Someone buried a tank, historic tank years ago, and it had eaten through, and we got water in our oil. So we had 60 days with a do not consume during a pandemic, which was amazingly difficult to handle. But we had great supports to the government of Nunavut and the government of Canada to get through that. But I think one of the main things was that regular life still happened. We had more phone calls about loose dogs, garbage overflowing, and you're sitting there like, as a leader, how do you, hey, I'm worried about people dying right now. These loose dogs, yeah, it sucks, but come on, right? I had a complaint from a lady that was, upset about the color of our new garbage bins. You're sitting there, and this is the kind of stuff that continue. It happens all the time, which is fine and very regular. But I think those are the hardest parts. Is that we were forgetting that our regular life still had to happen, and that we were just kind of COVID, and I think that was the hardest thing about the whole situation. And we're still not out of it. We don't really know what's going on right now. Everyone is loosening their restrictions, and COVID is still a major issue across the world. So, in the next couple of days and weeks, we're going to see how that happens, and hopefully we've picked the right side. We're not always going to be on the right side of history, but hopefully we picked it this time.
Well, we only have a few minutes left, but I wanted to have you all kind of reflect on what you are taking away from this. As you mentioned, Mayor Bell, everyday business still had to go on in addition to this massive crisis that overlaid everything else. How do you feel like you have been able to prepare for the next thing that comes along? One of the things that you mentioned was better communication between agencies and departments and government entities working together. Have there been improvements to communication systems or ways that you'll be able to reach citizens more quickly and effectively in the future when the next big thing comes up in your communities? And did the state and federal government help with some of that? Mayor Schroyer, you mentioned that there's still a big need for broadband in the Arctic. I remember at the beginning of the pandemic when we were reporting on schools that were delivering paper packets to students and picking those up, and wow, that's a big difficulty for a community to try to keep that up, for students to keep up with their education.
What Wi-Fi we do have, social media, TikTok, all these things that are in there, you can ask any first grader, second grader, they can tell you how to get on there and what. My grandson can call me off his iPad, and I'm like, how'd you do that? But they know what they're doing, and they are very intelligent. They know, and my son will tell me, Mom, you need to keep up with technology, and I tell him, no, I don't, I asked my first grader. So anyway, technology is really important. We do have technology, and people know how to use it. And I think that's something that I've really learned is we do use technology a lot. My son says I'm behind the time. Mom, Facebook is old news. But it's my social media. It's what my age group can identify with. So, those are issues that we still need the Wi-Fi, and when I retire, I want to open a blog, and I want to be able to say to the government on certain issues, you Suglu, you never got us Wi-Fi. Suglu means you told a little white lie to get reelected. So I want that for our people because our kids deserve that.
And do you think the federal money that has come into the state, will that help stand up some systems that you need to have in place for the next crisis that emerges?
We hope so. It said the government is providing a lot of resources, and it did, but then where's the guidance to expend it? That's what's lacking. That's what we're waiting on. Time is lapsing, and things are happening. People are dying. But we're still waiting on the government to provide the guidance to expend the resources. They say it's made available all across the country. To who? Where's the guidance? How do we get to that guidance? Who's going to help apply for that? Building up the broadband system that's needed across the North Slope even. I have to say North Slope as well, because we're lacking in that communication buildup. I know that there's that quintillion line that got put out there, and they're still struggling to further the communications lines and opening that up. But it costs to get connected to that service when we don't have when we have a high unemployment rate, and when you apply for the service and you unknowingly start looking through all that information that you're requesting for through the service, and then you get the bill at the end of the month, $1,200 for 1 month of use on the internet service. Do you want to go buy your lunch, or are you going to go pay for your bill? You know, that kind of, these are for real situations. And yet people take it lightly when it's accessible elsewhere in these urban areas. The thing about being in the rural communities, you don't see the realization of the costs for the services, where we have competing telephonic service providers, but there's a cost associated with it. Yes.
Your point about how to expend the funds and making sure that that's understood is really important too, because in a larger administration you may have people that can take that on full time, but when you're in a small administration, who does all that research and work? Mayor Bronson, what are the takeaways for you? We're out of time now, but give us your thoughts on how you feel the city may be better prepared in the future for the next big event that could be a public health crisis.
Well, I think on its face, you learn from your past. We learned what we did right. I think we learned from what we did wrong, and then, you know, next step forward, next iteration. COVID's always going to be with us. You know, there's an outbreak in China. It's probably going to come here again, and we'll know what to do better next time. And maybe that version will be more problematic for young people than old people, because we know in this one it didn't impact young people. There's no one under 20 that died from COVID in the state of Alaska, but it was very problematic for the elderly. So maybe the policy has to change. We simply have to adapt with the best information that's available. And I think that's the lesson we'll take forward. And we're smart people as a society. We'll figure it out when it comes, and we'll learn from our past.
All right, well, thank you everyone for your attention, and thank you Mayor Brower and Mayor Schroyer and Mayor Bell and Mayor Bronson.